Hi, I'm Janta Vinekar. I'm a psychiatrist in solo practice in Plainsboro, New Jersey. And today I'm going to talk to you about death and dying in COVID-19 era in this pandemic of 2020. Thanatology has been an interest of mine for the last 25 years, and I'd like first to talk a little bit about this science. Thanatology is the study of death and death related behaviors, thoughts, and feelings. The Uniform Determination of Death Act states that an individual who has sustained either an irreversible cessation of circulatory or respiratory functions or cessation of function of the entire brain, including the brain stem, is dead. The cause could be natural, which is secondary to illness, or unnatural, which could be secondary to accidents, homicides, and suicides. As you well know, this pandemic, the coronavirus, has caused some individuals to suffer from COVID-19, which has had a high mortality rate compared to some other viruses which are milder. Even with this virus, most of the patients have very mild symptoms and do recover. There is an incubation period of 14 days, which makes this very difficult to because of the contagious nature of this virus, it spreads very easily. Today, I'm going to focus on the grief and the death reaction that occurs with COVID 19 and how this is different compared to other grieving and bereavements. The grief reaction is has several factors. It's the nature of the attachment, the mode of death, the historical antecedents, personality variables, and social variables that determine the nature of the grief reaction. Elizabeth Kubler-Ross is one of the experts in the field who studied the different stages of dying. She stated that the first stage was denial and isolation, the second, anger, the third, bargaining, the fourth, depression, and the fifth stage of acceptance. There are several different death beliefs, and this has a very cultural aspect to it. Bereavement refers to the whole process of undergoing and ultimately recovering from the emotional, social, and physical consequences of personal loss. There is an acute phase of 3 to 6 months, and it lasts for up to a year sometimes for complete resolution of bereavement. Depression is often not clinically diagnosed, and this could be a normal grieving process. But for some patients, the grief becomes a serious condition and could be a major depressive disorder, and the symptoms need treatment with psychotherapy and medication. If the symptoms do not resolve in 2 to 3 months after the loss, a diagnosis of major depressive disorder needs to be made. The symptoms not characteristic of normal grief reaction are guilt about other things, that actions were taken or not taken by the survivor at the time of the death, thoughts of death other than survivor feeling that he or she would be better off dead or should have died with the deceased person, pre-morbid preoccupation with worthlessness, marked psychomotor retardation, prolonged and marked functional impairment, hallucinatory experiences other than thinking that she hears the voice of or transiently sees the image of the deceased person. When grief is complicated by depression, SSRIs and other antidepressants and cognitive behavioral therapy should be considered. Mourning is the early response to the fact of loss, and more specifically, death of a significant other. Grief and grieving refer to the impairment suffered. Pathological grief reaction is bereavement that lasts longer than 1 year, usually seen in dependent personality disorder or when the survivor has ambivalent feelings towards the loved one that is deceased. His family expresses relief that he seems to be back to his good old self. The characteristics of good copers, that individuals who deal well with grief, are the flexibility, resourcefulness, optimism, and pragmatism. Normal and pathological grief. Chronic or prolonged grief is the most common form of pathological grief. Those who experience pathological grief are those who, prior to their loss, tended to avoid confrontation and attempted to escape from difficult situations. Risk factors are high initial symptomatic response to the loss, lack of perceived social supports, unanticipated loss without time for assimilation, presence of multiple concurrent life events. Melanie Klein, a famous psychoanalyst, described mourning as a phase of disorganization and subsequent reorganization of both the inner and outer world of the mourner. She also indicated that one's way of responding to losses later in development is patterned on the responses to similar experiences in infancy and early childhood. Bowlby, another famous psychoanalyst, believed grief and mourning were an amalgam of anxiety, anger, and despair, following the experience of what is feared to be an irretrievable loss. When the loss is believed to be irretrievable, hope remains. He describes three stages of mourning: the urge to recover the lost object, disorganization, and then reorganization. He described the sequence of responses as protest, despair, and detachment. His theoretic orientation leans strongly on the attachment theory, that is, the disruption of attachment results in mourning. So, this gives us an overview of what it is to grieve and mourn a loss. COVID-19 is different because of the social distancing, and when a loved one is dying, they are often alone. Because of this difficulty in being with the individual at the time of death, the grieving process is extremely complicated. Not being able to say goodbye makes this grief complicated. Not being able to be with the loved one at the time of death makes this very complicated. Also, the funeral is difficult because the individual who is grieving the loss of a loved one does not have the gathering and the social support that is so important in the grieving process. Telephone, Zoom, and other technology is helpful. However, it doesn't take the place of having friends and family who can actually be with that individual in this process of grieving. Another complication of COVID-19 is that several individuals are not able to have the time to organize a funeral and they're going for cremation. Some of them hadn't planned a cremation, they had planned it otherwise, but because of the circumstances, they had to settle for cremation. And that's an issue. Also, to be home alone with the ashes and not having anyone to share that time of sadness with is extremely difficult. So, COVID 19 has brought about issues in death and dying, which are very unique to COVID, this era. And that's why what I'm seeing as a psychiatrist is that the process of grief is going to be very long and it's going to be complicated. And only time and further study in this will give us a better understanding of the long term implications of this pandemic. because along with the loss of the loved one, they have also lost job, and there have been other losses in finances, in families, where people have had to have changes made because of the loved one passing away suddenly. The whole restructuring process has been so dramatic and so acute that this is going to, only time will tell how this is going to evolve and how individuals are going to adapt to the new normal. Thank you.